The biggest problem that we have at the moment is the people who are sitting at home in isolation, not asking for help. What are we going to do for those people? We need to reach them.
Because there's no shop, no pub, no post office.
There's
nowhere for them to meet and have a chat, and I think that's vital, really, isn't it?
The old Mehel spirit where people came together, whether it was to do harvest or haymaking, the rural post offices, we know it in our own case, and after the rural shops, gone. And
we need to reconnect people with other people. The person who's sitting at home alone, connecting with nobody, we have to reach them. So we have to go to where they're at and then invite them in.
Ershka, Kele, Amwarn Nadina, which basically translates, in each other's shadow we all live. No man is an island.
I think people really do need to talk. I remember one particular instance that I know of, that a lad left a diary entry and it was mentioned that he was often in a crowded room at home with a lot of happy family members and he never still felt so lonely. So it can be just there sometimes that you don't know what's going on necessarily always around you.
Suicide, it's in every single community now. But it's not something that we must walk away from or something we must say, lads, it's awful. It's something we must tackle and we must tackle together.
It's reminding people of their strengths and their resilience. And when they can't find that themselves, they reach out to the supports that are available.
It's good to talk, but not only is it good to talk, it's good to listen, it's good to watch, it's good to observe. And I think every one of us could possibly, if we do that, we may help somebody through a time of need.
So while the vacuum has been created with the pubs gone and the Cork culture gone, we must now replicate or replace it with something else.
And on the one hand, it's sad that it has come to this, and on the other hand, isn't it great that we're doing something about it?
It's a collaboration with the HSE and the partnership companies on the ground in North Cork.
The HSE would have approached us in response to an identified need and to look at, were we interested in coming together to work on a project to put rural community health workers into the rural areas of North Cork.
I don't think there's any example of this in the country in terms of the collaboration involved with the partnership, with the voluntary sector and with the HSE. Well, I think in terms of collaboration it was important for us to involve the partnership groups because you're the ones that are close to the people on the ground or close to the communities and you know the communities.
Yeah.
This is something we can't do on our own.
Lovely to come and visit these small, rurally isolated communities and get to know the people, the community councils, the leaders of groups already in communities, and introduce myself and be a familiar face on behalf of Ballyhowra and the activities that Ballyhowra can offer in these communities.
We have staff in the communities, like we've an office in Mitchelstown in County Cork, an office in Charleville, County Cork, and there's other staff in those organisations. So now we've the additional resource of Jackie just working in community health, community mental health, but she's able to work alongside the other workers working on the SICAP programme.
That's right.
Working with the links into the community.
And it's very strategic then, from our point of view, having that direct link into the rural community.
It's a big partnership and collaboration, a network of support.
Every organisation has their strength, and the HSE are very good at what they do in terms of caregiving and supporting. But I think the local development companies are embedded in the community, in GA clubs, in soccer clubs, in community councils, and we can engage them quickly. And I think they trust what we deliver, and they know from previous engagements that and supports they've received that we're organisations that have their best interests at heart.
Shanballymore is a very small little place. We've no pub, we've no shop, no post office.
The post office, well, that's where people go to collect their pension or post a few letters or whatever, and that's where the chat happens, isn't it? So I mean, when the post office has gone from...
It wasn't just the post office service, it was the social.
Exactly.
Yeah,
that connection.
You're looking and listening to the different calls that are coming in from the communities, what the issues are. We're working with migrants in the communities, we're working with people with disabilities, we've carers groups, women's groups, we know what's going on, and that's constantly being fed back to us through community consultations.
Hi Marie, how are you? They're good. I'm just checking in with you that everything's okay for later.
Yeah, I'm
That's great.
You could have someone coming in for one support, but there's a family member at home in need of something else. It's great that the community section of the HSE recognised the relationship that we could have here.
Yeah, I think the HSE have been critically important, not just in terms of funding, but in terms of bringing the wide expertise that they bring in terms of healthcare, mental health, to improve the work that we do.
So we kind of came together as a group and we said, okay, so what's really required? So we need to kind of formulate something that's really tangible, that can really be felt on the ground, and that can really, really target the rural communities. We said, okay, let's have the focus suicide prevention, suicide intervention, and suicide postvention. So suicide prevention really informs members of the community with up-to-date relevant information on how to access supports for themselves or others who are emotionally vulnerable or who may be having thoughts of suicide. So suicide intervention then will include delivery of a suite of suicide prevention training programs, both face-to-face and online. So suicide postvention then looks at how we can support individuals and communities in the aftermath of a death by suspected suicide or murder-suicide.
I suppose Safe Talk, people ask first questions always, what is Safe Talk? And I suppose that the important thing is to say, I feel, is it's better to have it than to be looking for it. Because I think when people come across someone who might be having thoughts of suicide, it's difficult. The questions or the answer always is, I didn't know what to say. I was afraid in case I'd say the wrong thing. I wasn't too sure what words to say or what action to take or who to ask for help. And I suppose that's what Safe Talk is about. You know all those things from the training, and that's great just to have that for yourself.
But just even from delivering one recently, a Safe Talk, and then I met the same person again a few weeks later at the Assist, and they had had a really important conversation with someone close to him. And the outcome was really positive, but they like only from doing the training they had the confidence to have the conversation. I feel you're empowering people. We attended the local mart. We did a men's health check. We had the ETB. We had the Irish Heart Foundation, the mobile truck, and we had the Irish Cancer Foundation, the mobile truck as well. Often people would think that there's not much help and support there, but there actually is a massive amount, but it's trying to connect, again, to signpost people to it. Even that flyer that this person might pick up, that mightn't mean anything until a few months down the line and realise actually MABS is a service that can help me here if I'm struggling financially. So I suppose it's just giving an opportunity to get the information.
We held the Hello, How Are You coffee morning, and that was a great opportunity to just have a simple cup of tea and say to everyone that we meet in the centre or in the community hall, hello and how are you?
There's people that haven't seen, other people from one end of the week to the next, and they come down, they sit, they meet their neighbours, people that haven't seen in a long time, just have a cup of tea, cup of coffee and a chat, and someone might bake, and that's really it. It's just nice social, people interacting with each other.
So that's been it. I suppose I've had 2 community walks. The first one's in Ballyhooly. I had 30. It was absolutely lashing rain. It was really well attended. Everyone was obviously kitted out for the weather, but and it was families as well.
So I organise kind of community walks. So we do local village kind of walks, and obviously we go to each individual village within the North Cork area. More often than not, there's teas and coffees afterwards, and that's where the chat happens. And it's lovely to see, I suppose, when you go to different villages and towns, people might turn up and not have seen each other for even prior to COVID or even in school one time. So it's lovely to see the conversations happening afterwards and the catch up, and that's what it's about. It's about connecting people back into the community.
I'd like to jive as well.
Yeah, I love jive.
A bit of dance.
Do they go in to see it?
They do.
You create an activity, you create a space where people can come. They are happy places to be yourselves, and just to relax and socialise together as well.
Do you see it? You're not getting any. Great for me, for my mental health, and I love pottering around out the back with the pots. I don't have ground, I've all concrete. but I've all pots and I love planting. It calms you down. It gives you're more at peace. You know, if there's something going on in your head and you go out in the backyard, out in the fresh air and you're at the pots, I think it just calms you. And you also get a sense of inspired by plants that grow that you did it. You know, that kind of way that they're grown, I planted them. Your own peace of mind and your own mental health, like, you know, what's going on at home, you leave at home and you go up there and you have a cup of tea and you have a chat.
There's things in life that we must do or should do that we might not like doing. And minding ourselves comes into that category, believe it or not. Now it shouldn't, by the way, because you think, if you stood back and thought for a few minutes, sure you'd say, isn't it common sense that the first thing we should do is mind ourselves? Why the hell shouldn't we? And it still isn't it. I'd actually be amazed if most people here today have ever sat down for 4 or 5 or 6 minutes ever and sat down and said, God, I'm going to think now about planning my own well-being and I'm going to have a strategy from now on to mind it myself.
We need people around us, even if someone is quite happy living up at the back of the mountains on their own, and if that's where they're happy, that's okay, if their well-being is good. But we do need to feel connected to people.
And then roll those shoulders up, back and down. And then turn your palms to face forward.
On the ground, as a rural community worker, you can see what's needed, you can see the facilities and services that are maybe lacking, and to provide the service going forward for the demographic that you are working with.
A lot of people will wonder, why do I need counselling? How will it help me? Well, there are times in all of our lives when counselling may be helpful, including times of distress, times of major change, times of loss, experiencing challenging times which will have an effect on our emotional and our mental health. And then there are times when our self-esteem and our confidence are low. So, across the board, counselling is ready for anything.
We have a Towards Occupation programme here, so we have that project twice a week where they do various activities and social events and health and wellbeing activities. So it could be walks, it could be arts and crafts classes, computer classes, personal development. And you'd have a lot of referrals in from likes of OTs or the various health professionals who would maybe recommend someone to come and join that programme as well.
The way that I've done it is there's just a different work with them, that it's looking after their own well-being and self. If I'm doing a quiz, it's related to well-being. If I'm doing something, it all connects back with it.
It's quite relaxing and comfort, and there's no noises or anything, or shouting or whirling or anything like that.
That's the TO group. Reading for the Brain is a book club, so they meet once a week. There's 22 now registered, because after getting 2 or 3 new ones since I'm after starting, say.
It's from working on the ground. It's the likes of, in a position like myself as a rural community health worker, it's not necessarily targeting a person and just insisting that they join a club or a group or whatever, but it's just to make the connections. Maybe if I go to all the different meetings like the active retirement groups and stuff, that they see the face, now there's a connection there, they know who they're talking to. If they do make that phone call, it makes it a small bit easier for people to connect. There's no men involved in the walking group and the book club, and it's to encourage them or maybe get ideas of what could happen going forward. I have gone out and I've met a couple of the active retirement groups and men's sheds and the vintage club, so it's just to make those connections. Okay, they're interested in vintage, but they might also be interested in the book club or in the walking club, but they just haven't seen the advertisements for the facilities and services that are already there. I'd always be telling the groups that if you know someone that is living in a rural area, isolation, mental health issues, that to encourage them to come, give them the contact number, pass it on to me, and that I would ring them, because I often find it's the initial first contact that's the hardest thing for someone to do, that they might actually find it very difficult to pick up the phone.
The role of the local development companies on the ground is we have the contacts, we have the relationships. It's built up over the years, and that's what this project shows. You have to have partnership. The HSE come in, And yes, they have the funding and they have the resources, but without having the know-how from the community, the local development companies on the ground, knowing the community groups, knowing the community leaders, it's not going to work. There's a lot of sharing of experiences. So what Avondhu might have done last year, we might look at rolling out here this year, and so on and so forth. There's a much stronger relationship now around the table with other healthcare professionals. There's that recognition that, okay, this is a bigger project in the region, and there's healthcare professionals tapping into it because it's part of a HSE model. The HSE are also bringing the know-how, the training, and there's other healthcare programs that they have maybe in the city that are now coming down here as well to the rural areas. So it's not just a funding arrangement, it is a joint project.
There's local development companies, there's health promotion, there's community work, the community and voluntary services, the counselling services, all coming together and working together. Somebody says something, that sparks an idea with you, you thrash it out, you have a discussion, somebody else brings in another idea. It becomes much richer and it becomes much more meaningful.
It's almost like a learning environment where we're all learning from each other to support the workers and to push it forward, really.
It's a great pilot project that could be rolled out across the country for other HSE divisions to look at with other local development companies to see how it works very, very well.